Stimulant medications can have some side effects, and a lot of that is dose dependent. Some of these side effects are transient, but the one specifically addressed here is the visual disturbances. What initially, draws my concern is blood pressure. So, not knowing the context of the patient's age, I would right away want to know if the patient's blood pressure was increased when Adderall was started, because that certainly can cause some blurred vision. There can also be issues with migraine headaches, and migraine headaches can just present as visual aura symptoms, not necessarily with pain. And so we would want to look to see if there's any migraine history and whether those are being provoked by the medication as well. Sleep disturbances can cause issues. Sometimes people will describe some issues with chronic fatigue, and that can present with a variety of symptoms. Believe it or not, sometimes a stimulant medication can also cause patients with temporomandibular joint dysfunction issues to have a flare-up, and TMJ can be associated with headaches and muscle spasms and occasionally dizziness and visual changes. So that would be something we would want to investigate in greater detail as well. Sometimes it's just a matter of backing the dose down or changing the formation or the formula, from extended release to an immediate release or vice versa. There are a lot of options to address, but I think that would be one of those symptoms, one of those side effects that I would want to spend some time digging into. It's not one that I would recommend we ignore.